Hello, my name is Steven Adade. I am a social worker. You can follow me on YouTube, Adade Kweku Steven, or on Facebook, Adade Kweku Steven. Today we'll be talking about one of the therapies or one of the theories in the social work practice. And one of the things that all social workers need to understand when they sit before their clients. And one of the things that we have to understand is that social workers, we deal with clients, we don't deal with patients. So the difference is that when you are dealing with a client, you see the person as your co-equal, like you are equal, you are one, you are the same. But when you are dealing with when you're a doctor is dealing with a patient, it's like someone who is sick. The person is helpless. So the doctor has to do everything to help the person. But when it comes to the social work practice, you allow the client to propose, and you guide him or her to come out with the best intervention or the best solution to the problem. But with the doctor does everything. He gives you the prescription and everything. The prescription is imposed on you. But with the social worker, dealing with the client comes out with, sometimes you allow the client to even come out with some of the solutions that he thinks will help him to resolve the problem that he or her is going through. So this is just by the way. So we'll be talking about Carl Rogers. Carl Rogers centered therapy, or the client centered therapy. So, as the name suggests, client centered. So, Carl Rogers believed that in helping individuals or in helping people, it could be easy, it could be simpler, it could be more optimistic than what we know as the psychodynamics or the psychoanalytics. So he believes that in helping an individual or in helping a client, you should look at the present situation. You should look at what is at hand. So he does, even though he believes in the past, that is the psychodynamics. With the psychodynamics, Sigmund Freud, he believes that whatever that the individual is going through permanently, that problem, if that problem could be solved, then you must understand the individual past, what the individual has gone through in the past. You should be able to understand that to be able to solve the current problem. But Carl Rogers believed that if you are handling a client, you should be able to understand what the individual is going through currently. And that is where you have to allow the individual to do what? Express himself, to tell you what he's going through. So Carl Rogers came out with three things that the social worker should understand when he is handling a client. So he called them the core conditions. So I call them the three core conditions. So one is the social worker should be congruent. Two, the social worker should understand, or the social worker should provide the client with unconditional positive regard. And the third one is the social worker should provide the client with empathetic understanding. So you should empathize with the client in simple things. So what does it mean for the social worker to be congruent or to be genuine? What does it mean? So it means that every individual. So let me take you to the field of social constructionist theory, or the social constructionism. So that theory tells us that every individual comes from a community, comes from a family, has a background, has a social context. So that theory believes that the community creates us. The community makes us up. So it means that each and every one of us, we are coming from a certain background with certain understanding to issues. So when you become a social worker, you should, whenever you are coming before a client or whenever a client is coming before you, you should be able to leave all those luggages, those understanding, your perceptions, your experience, you should be able to put them behind and come and sit with a client with clear mind, with clear genuineness. That is one. Two, one of the things that Carl Rogers believed was that you should be able to bring the client to self-actualization. That is the end result. The end result is that the client should reach self-satisfactory. The client should be able to achieve self-actualization. So he says that you should as a social worker, you should be able to portray, also be able to plant in the client that positive regard. You should let the client understand that you are listening to him, you are following him, you are understanding what he is saying. You understand? So that's the second stage. And the third condition is the empathy. You must empathize with the client. You must let the client see that you feel what he is going through, he or she is going through. So these are the three core conditions that Karl Marx has placed before every social worker or a therapist who wants to handle or who is handling a client. Moving from the three core conditions, we have 10 tips for every social worker. So I'm going to give you those 10 tips. So when you want to use the client-centered therapy, there are 10 tips that were proposed by Tang that you have to follow or you have to understand to be able to use the client-centered therapy. And one of them is you must set clear boundaries. The social worker should set clear boundaries. So you know that when you are having a session today, it's from 2 to 3, and it's 2 to 3. You come on time and all that. You must all agree on the venue that you'll be meeting. You must all agree on what you're going to discuss on that day or within that session. So there must be clear boundaries. You must set those boundaries as a social worker. And the second point is that the client knows it all. The client knows it all. The problem is the client problem, not your problem. That's what you should understand. And it is the client that is going through the problem, not you. So you must understand that the client knows it best. So you must try to you must also try to understand it from the perspective of the client. You must be able to understand. And so when you come with that clear mind that the client knows it all, you'll be able to listen attentively to whatever that he has to say. And the third point is that you must let the client know that you are listening to him. How will you do that? So sometimes you have to ask recurring questions. So when he says something, you try to repeat it and try to let him understand, okay, is that what you mean? Do you mean this? So you should be able to ask him all those questions so that he would understand, okay, yeah, this man is following me or this guy is following me. Understand? So you must let it sound. You must let the client know that you follow whatever that he is saying. Don't be judgmental. I know this is a principle that every social worker knows. You must never be judgmental. You must never be judgmental in your dealings with your clients. So because you've met a client who says who went through the same problem that the new client is presenting to you, does not mean that the problems are the same. So you just conclude, no, don't be judgmental, or don't try to fault your client that, oh, this thing happened because of you did this or that. No, don't be judgmental. That is the fourth point. Don't make decisions for the client. And we all know that social workers don't make decisions for their client. They guide the clients to make decisions or bring out solutions to their problems, as I said earlier on. And the sixth point is that you concentrate. You have to concentrate on what they are really saying. So you pay much attention to what they're saying, and it must appear to them that you are paying attention. So it means that you shouldn't be looking outside the windows, you shouldn't be talking to other colleagues. You must pay much attention to the client, and you have to be genuine. And when you pick the whole or the totality of Carl Rogers' client-centered therapy, you realize that its strength is built on genuineness, both from the social worker or the therapist and that of the client. If the client is not genuine, you will not be able to come out and bring the necessary interventions that will help solve the problem. And when the social worker is not genuine, he will not be able to guard the client to come out with the best interventions. So this genuineness is key in the practice of the client-centered therapy. And when you move from being genuineness, the eighth point that you have to understand as a social worker is that you must accept every negative condition. You must accept every negative condition. So you shouldn't appear to be harsh on the client whenever he is going overboard or he is becoming aggressive. You should try to calm the client down and try to accept who the client is, and then try to propose the necessary interventions and try to guide him so that both of you can come out with the necessary interventions to solve the problem. How you speak, your tone. What you are saying may be right, but how you say it may be wrong. So your tone is very important when you are talking to your clients. It's very important. The words that comes out of your mouth are very important. It can kill the client. The truth is that mostly what the client tells you initially may not be right or may not be the right thing. So it's all about the rapport building, the understanding how genuine you are, that will help the client to come out with the necessary or come out genuinely to tell you what you need to know. So what you say, how you respond to the client is very necessary, and you must be careful what comes out of your mouth. You should be conscious of that. And the third point is that when you are going into the client-centered therapy, you have to understand that you can't do everything. You can't solve every problem. You must appear that, and you must let the client also understand that you will not be the one to solve the problem. You will not be the only person to solve the problem, and it has to take both of you, or resources may come from other places to be able to help the client solve his or her problem. So these are some of the few tips that you must know if you want to use the client-centered therapy to help a client. So greetings from the Save the Society Ghana, an NGO that is based in Ghana. You can always come along to help us support the needy and all that. So continue to watch my videos and subscribe to my YouTube channel. My name is, as I said earlier on, Alade Kweku Stephen, and I am a social worker and I'm from Ghana. Thank you very much for listening to and watching this video. God bless you.